Welcome everyone, and thank you for joining in today's webinar, which is a part of Grow with Geistlich series. I'm Mukta Sandhu from Geistlich Pharma, and today's topic is dental photography, basic principles for dental practice. As you all know, this series is for your personal development and for your practice. And in this session, we'll discover the essential of dental photography, from choosing the right equipment to mastering the key settings. Today, of course, we have our moderator, Dr. Amit Patel, who is a famous periodontist from Birmingham, UK, and our speaker, Dr. Manrique Fonseca from Bern University with us. And I would like to thank both of you from Geistlich Pharma. So Dr. Patel, I would hand over to you so that you can help us explore how dental photography can become a powerful tool in our dental practice. Over to you now.
Thank you, Mukta, for organizing this fantastic series of webinars. And again, thank you for Geistlich to also organize this as well. I think it's great for young up-and-coming implant dentists to have access to a new generation of lecturers. So today we've got Manrique Fonseca, who is a very young, talented prosthodontist who actually, I have to be very honest and say I'm very jealous, because he gets to work with Danny Boozer, who's one of the godfathers of implant dentistry. Manrique is a program director at the postgraduate program in reconstructive dentistry and oral implantology at the University of Bern. So today he's going to give us a lecture on dental photography, and I'm sure you're going to learn as much as I am. Manrique, I'll leave it in your hands.
Great. Thank you very much, dear Amit, for the nice introduction. Thank you, Geistlich, for the invitation, and thank you, Dr. Sandhu, for the great organization. So as you heard, we're going to be talking about photography today, and the goal is to help you take better pictures in your practice. And we could talk for hours over dental photography, but we prepare for you today a short overview, and we're going to be covering the following points. You are going to be seeing how is a picture created, what is photography, why photography in dentistry. For the ones of you considering getting a new camera or changing it, then you are going to have some information and insights between the type of cameras that we have and equipments. And then, very important, the settings that we need, the basic settings, the pillars of the photography, the three most important ones. There are a lot more. And then some common mistakes that you can make so that you avoid them. And then we're going to have some conclusions. So we're going to start with the definition of photography. What is that? It is the art of capturing light with a camera to create an image. It is like painting with light. Now the question is how a picture is created, and it is basically an optical system. So imagine you have veneers on a model that you will cement tomorrow in your patient. So if you want to take a picture of those veneers on the model, you need light, and that light is going to be reflected on your model. And basically, if you focus on the image that I have here, this light is going to come into a sensor that the camera has, and that sensor is sensitive to light, and then the light is going to be captured, and then an image is going to be produced. And then we have the question, why we dentists have to know about photography? And there are a lot of reasons for that. Here are some examples. For me, the most important one is communication with my patients and with my team. I don't know if you are aware, but sometimes we talk with the patients with some terms like crowns and removable prosthodontics, fish prosthodontics, dental implants, and we assume that the patient understands all those terms. But in most of the cases, it is not like that. And you have to explain the patient what are the challenges, the risks, the limitations that we have in their cases. What is the diagnosis? For example, here we're going to do longer teeth to improve the aesthetics, and pictures help you to get all that. We're going to plan a crown lengthening here. So if you show the patients, because most of the people that are visual, if you can show them that they are not cleaning very good, that this is not okay, they will understand much better. And when you're discussing treatment plans, are we going to go for fixed prosthodontics or removable as well? If you have case examples, then the patients are going to be able to understand much better, and then you will win their trust. And if you do that, you will have patients forever in your practice, and they will be referring more patients to you. And then not just with the patients, the communication, but with the rest of the team that is going to be involved in the cases. Orthodontists, dental technicians discussing the treatment plan, periodontists, or in these cases, I discuss with my technician what type of preparation we're going to do, what type of ceramic we're going to use, improvements of the color. Here, the color was not very good, and then how can we we can do all that in order to improve the situation that we have at the clinic. Then the before and after is one of my favorite ones. And at the clinic, of course, in a postgraduate program, we do that. But of course, in your clinics, it will be also a good way to do that, also for legal reasons. If you get sued from a patient, hopefully not, but if you have documentation also supported with x-rays, this is going to help you a lot in order to support the treatment that you choose in that case, right? And then, of course, teaching as well. And then, of course, social media or publicity for your clinic in the website or your profiles in order to communicate with the clients what are the treatments that you would like to do and what do you offer for them, right? Then it is combined this also with art and very nice picture that you can post and then share with your clients or with your referral dentist as well. And then one last thing, it is also the dental shade matching here, for example, using polarized filters. That's a filter that you can get, and then you get these pictures that are not bright, they are matte. And then you can upload that into a software, and then the software is going to tell the dental technician or help the dental technician with the colors of ceramic that he has to use or she has to use in order to do better upper front reconstructions, for example. Next topic is the types of cameras. Is there an ideal camera for all settings? Let's dive on that. We have compact cameras. We're not going to talk about them because those are the very simple ones that they are not indicated for dental photography. We have semi-professional cameras, and we have professional and mobile photography. The semi-professional, they are also not very good or recommendable for dental photography because those are these ones. You cannot add a flash. The lens is fixed. You cannot exchange it, so you cannot take macro pictures. So for that, we don't recommend that for dental photography. The best ones are professional photographies. And over there, we have a wide range of models with different prices. So you can have simple ones from around $500 until the professional ones, the most expensive ones, the best ones. They have everything, a lot of functions, but then you go to prices up to $5,000, $6,000 just for this part of the camera, just for the camera, not including the lens or any other equipment. These ones get you very good results. You can fully manual. You have a lot of functions that you can change over there, and highest technology, very good. And most of dentists are using these ones in the world, I would say, but that is changing. And regarding the professional ones, we have two. We have one with mirror, and then we have without a mirror. And the older ones are with mirrors, and as you can see the red line here, then you have the light coming in and it's rebouncing in several mirrors and then get it into the sensor. And the mirrorless ones, they are simpler, they are the newest ones, and they don't have this mirrorless. So the light is coming straight into the sensor, and that makes that the camera might be smaller, therefore lighter, and they have a lot of electronic improvements, including the smart focus, but some of them, they cannot, they don't have a micro lens, but that is changing, okay? And then we have a revolution, and the revolution has been with the smartphones. And I remember the first courses that I was having in dental photography a lot of years ago, they were not even considering the speakers at the time. They were saying, pictures with smartphones, that is ridiculous. The quality is not good, the light is not good. But now we have so good cameras in the smartphones that if you combine them with proper accessories, I will show you right away what I mean with that, then you can have very high quality images. So as I said, it has been a revolution in clinical documentation, and the advantages I will show you also right away. You can also go with camera settings, the manual ones that I will show you in a couple of slides, and then you can get a very, very high quality images. And for me, I was always, I gotta be honest, very reluctant with that until I was in a congress in Spain, and Professor Hardan was giving a lecture over there, and he wrote a book about mobile photography. So if you're interested in that, you can check it out. And he was giving a lecture, 1 hour lecture, and all his pictures were taken with a smartphone, and they were very, very good. And the key for success for him is that he designed this flash, let's say, this auxiliary light for the smartphone with a Swiss company, Smileline, and they have also polarized filters. They have also diffusers. I will show you what that is later on. And then they're getting very good light, and combined with a modern smartphone with a high resolution camera, they are doing very, very good pictures, or you can do as well in your practice. So the advantages basically of mobile photography are that it is cost effective. They are very easy to use. So even your dental assistant can help you with that if you have the proper accessories. Again, you need very good light and to get intraorally into the teeth and take nice pictures, and then portable and easy sharing. You should also consider the limitations, and though the main limitation for me is data protection. I don't know how is it in your country, but in Europe and in Switzerland, it is not allowed that we use our personal devices in a clinical setting, and that we have information, private information of our patients safe in our personal devices. And that is why in my setting, it is not an option. But perhaps in your country is different, and you can consider that. Some say that the image quality changes, but that depends, of course, in the model of a smartphone that you have, and that the storage may be also an issue. So going back to the question, what is the best camera? I would recommend whether professional or a smartphone with a good accessory or a good light. By the way, this option is not the only option. There are several options to get auxiliary lights for smartphones, so you may check on that. So the best one is one of those two. Which is the best one? It depends on your case and depends on the clinical setting that you have in your practice. Like I said, in my case, it is not allowed to use it, so I have a professional camera. But perhaps you are the owner of a clinic and you work with 2 younger dentists, and when they are in emergency call, they can send you pictures with the smartphone of the clinic, and that is an option for you. So if that is an option, just be aware, if you have the proper accessories, you may get very nice pictures. So regarding the equipment, we have the camera itself, we have the lens, we have flashes and accessories. So let's check them out quickly. Regarding the lenses, we recommend macro lenses, and macro 100 millimeters. If you get this macro lens, you're gonna get a magnification ratio of 1:1. So you're gonna have the 1:1 size of a front tooth in the front, for example, in the upper jaw. And then the other question here is, should I get original ones or should I get generic ones? What is the advantage of generic ones? They are cheaper. And the original ones, they're basically higher quality because inside the lenses are made out of glass. And that is why it is more expensive to manufacture, and therefore they are more expensive. The other ones, the generic ones, mostly are made out of plastic, and that is why they are cheaper. But both are very good in quality. They can do very nice pictures. Regarding the flash, you basically have 2. The ring flash, it is attached in the front of the camera, or you can have the light coming from the side with twin flashes, okay? And over there you have original and you have also generic ones. The LED flashes, we do not recommend. Most of them are not very good. And then you may have also extra accessories for those flashes, the twin ones, and those are brackets. Most of them are made out of metal. They are very good because then you can play with the distance and the effect that we want to have on the light. You just have to consider that they might be very heavy. So if you get one, try to get something out of plastic or carbon or any material that is not that heavy. We have some of these ones in the clinic, and they are really, really heavy. And sometimes when they're taking the picture and then holding a mirror, then your hand is shaking because they are so heavy. So keep that in mind. And then we continue now with the settings of the camera. And usually where some of colleagues that they have no experience in how to manipulate the settings, they use automatic mode. Or if we use the camera also in a party or in a social event, we use manual mode, and most of the time, a lot of time, they work. You get a pretty good image, but intraorally, the experience is not very good with most of the automatic modes. So the recommendation is go to the manual mode. And with the manual mode, you can change a lot of things, guys, hundreds of functions over there. It gets very complicated. We're gonna summarize it into the 3 pillars of the photography. This is the ISO, the shutter speed, and the aperture. So the common effect that they have is they regulate the light that is coming here into the lens, and together they provide the exposure of the image. So if an image it is underexposed, it's going to be very dark, and if it is overexposed, it's going to be very white, very light. Okay, so let's check first of all the ISO value. It is basically the light sensitivity of the camera, determines the light sensitivity. The higher the value, the more sensitive the sensor is to light. So the ISO look like this in your cameras if you have an Nikon of a Canon, for example. And then the higher the value, usually we are in 100, we will check the values that we recommend. But if we're in 100, if you go higher, then you're gonna get a clearer picture, lighter, more light, but then at a cost of the pixelation. So you get a higher noise. Here, take a look at these examples. Again, 100 is usually what I use in my camera. 100 is very good. If you go higher, here is clearer, check this out. If you go higher, then you get more noise. It is gonna get lighter, more light, but at cost of more noise. The next one is the aperture. So if I usually keep it on 100, the ISO, and if the picture is too dark or too light, I play with the aperture, but that is my personal preference. The aperture is basically like a diaphragm, like the iris of the eyes, and it regulates, here it opens and closes, and it regulates the amount of light that is coming in. So the higher the value, take a look here, f32, the higher the value, the less light is coming in because the closer is the diaphragm going to be. And then the lower, then the opposite, then the more light is going to come in. Here are some examples. And also the depth of field, the sharpness is also going to be regulated with this F value or aperture. Here are some examples regarding the amount of light. If you go very high, it's going to get a little darker, and if you go very low, you're going to get an overexposed image. So again, here f40, dark, underexposed, too light, overexposed, and you wanna be around in the middle. So f22, f32 in my case are very good. The definitive settings depends on the camera that you have. Regarding the depth of field, I'm going to go back, sorry. Depends, it is low. If you have a low value, you're going to have just one piece focused. If you have a high value, you're going to have, let's say, more teeth in focus. And I have a very good picture in a couple of slides so that you understand that. So if it is low, just a little bit is going to be in focus. If you have a higher value, you're going to have more of the surface of the object that you're photographing than in focus. And the last setting that we have is the shutter speed. And I have a video for you so that you understand. It is basically, let's go to the video right away. It is like a curtain, like a door that opens, and you can choose fractions of a second so that the light comes in. This is a slow motion video. Or you can choose and change it so that it keeps open, it stays open for a lot of seconds, and then you get an image. And then you can play with those effects and get, for example, when you see pictures of a highway and you see the light, the car lights that are one line, this effect you get when you play with the shutter speed. But we don't want that when we're taking intraoral pictures. So basically in dental photography, we stay with the value 1/125, okay? And then if you go up with that value, then you may have, if you alter that value, you may have this motion blur. So again, if you're taking highway pictures or a waterfall picture, you may want to have this effect. But in dentistry, we are with the static objects, so mostly we want to have something like that. And this is a summary of the three pillars or the three settings that we use. And you're going to get a PDF if you want of these 2 slides. We have 1 slide for the extraoral settings that we recommend or that we mostly use. But again, guys, it depends on the camera that you have, then those settings may change a little bit. Okay, so for extraoral, with the aperture, the f value, we go a little low to around 11. Shutter speed, intraoral or extraoral, we stay with 1/125, and generally with an ISO 100, you get nice pictures. If we go intraorally, the shutter speed and the ISO stays the same, but you want to have more depth of field, and that is why you go a little up with the aperture, okay? In my case, I even go to f32. And then we have flash settings. So if you have a camera like this, and you have a flash that looks like this, you may have 2 options. You can go automatic. The automatic mode it is called ETTL or TTL, and you have also a manual mode. And let's check it out. If you go into the automatic mode, basically what the flash is going to do. So the flash is basically a light, right? You're gonna lighten intraorally or the model that you wanna take a picture of. And in the automatic mode, basically when you push the button to take the picture, in fractions of a second, there is an electronic function in the flash that is going to take a measurement of the light that you have in that room. And if it is too light, then it's going to give you less light it's going to shoot less light, and the other way around. So those, depending on where you are, or if you are like me in your clinic that you have a window in front of your camera, then you may have false readings, and that is why we recommend to go to manual as well. And then you can choose, and you will always get the same amount of light. So the flash is not going to do any measurement, it's going to do a light, and most of the cases you need half of the light or 1/4 of the light, and not 100% of the light. And this is very important. The lighting is in photography, it is all about the light. So you may have not a very expensive camera, but if you invest in good light, you may have very, very nice pictures. So it is not just about getting the most expensive camera. And here, as you can see, if you play with the position of the light, with the background, you can do so many nice things extraorally with of the models. With if you do pictures of metal, you need a white background preferably, and it depends on what you can do. A lot of things, guys, with the light. And then here, if you have those twin flashes, there are also light modifiers. I get this from this website, Dental Photo Master. Check it out. It's also very, very good. You can get a lot of accessories over there as well. And then take a look at the diffusers. The position then is going to affect the direction of the light, and therefore affect also the effect of the quality of the picture that you're going to have. So you have to keep that in mind. And here, one video of an example, how important is the light. Take a look at the texture of this cookie, and the light is coming from the side. And if it comes from the side, then you see more the roughness and how rough that surface is. And the same is when we do pictures of crowns, for example. Here in the front, you may see some texture, but if you turn it a little bit, you go down with the light and the direction changes, you appreciate much better the texture of the crown. So those, you can play with all those effects with light, and that is why light is essential to get nice pictures. You also need good light, good equipment, but if you make rookie mistakes, you're not going to have nice pictures. So consider these ones. The first ones is the aperture. So remember, we said the depth of field is very important, especially if we take front pictures, and we dentists take a lot of front pictures in our patients. Take a look, the aperture, if it is the wrong one, in the posterior part is going to be blurred, not in focus, just the front teeth are going to be in focus. So if you want more depth of field, you got to go up with the aperture. So this is in my camera, it is 32, and take a look, front teeth and posterior teeth are in focus. So don't forget that. Blurred pictures are usually because you have not the shutter speed not in 125, you have it a longer shutter speed, so the door stays longer open, and then you have that blurred effect. And then the position is also very important. If you are down, you're gonna get this effect that it is not right. If you have the right angulation, which is slightly up, you don't have to be perpendicular to the patient, slightly up, then you get a very nice inclination or angulation of your picture. And then here, we have also the position. Usually the patient is sitting in the chair, and then we come from the side. And if we don't correct that, whether we move into the middle or we tell the patient to tilt the head, then you're going to have the wrong angulation, and then the dimensions, as you can see here, are not going to be in the middle. So you have to make sure you are positioned in the middle of the patient or on the front teeth. And then lighting issues, this is what I mentioned before, changing all those settings, the flash settings and everything, gonna get you to get an underexposed picture, which is a dark picture, or you may have an overexposed picture. And our residents are the clinic, they manage very good to take nice pictures, but at the beginning they tell me, oh, it is a little dark, it doesn't matter, I can change it or adapt it in the Keynote or PowerPoint software. But sometimes then you lose a lot of the quality, so in the resolution. So I don't recommend you to do that. I recommend you to go to the problem, why are you getting those effects, and try to change them, then get a better lighting from the beginning. And then finally, we have this post-processing softwares. We don't get into detail, very expensive ones. The most professional ones are these ones that you see. But of course, there are a lot of other ones. For the smartphones, we have a lot of applications that you probably know better than me, where you can add effects and change a lot of things. So you can have also over there a lot of effects like these ones that I think they are very, very nice. And with all those softwares, you can just try to give the effect that you want to have for your website or for your social media. And then finally, I have some pictures here for you guys to show you more or less what are the settings that we have at the clinic. And as you can see here, we have soft boxes. Those are soft boxes. They are the lighting is very, very nice. You can also change the intensity. And then we have backgrounds here for the patient. We have different backgrounds, and we have also just materials that were over there that we use as towels, let's say, as backgrounds. And then we also invested in a very nice table that was designed by a dental technician. This guy here is Joachim, from a dental technician from Germany. He designed this photo table, which is called Joe Stage. And there are so many nice things that you can do with that. You can buy those cheap flashes, and then you can do you can have a lot of different effects, and you can have also combine it with soft boxes. There are so many things that you can do, and then you are going to have some nice pictures like these ones that you can see here. Those are regular implant restorations, and then those are complete dentures, individualized. And you see those are pictures with light soft boxes, and the light, it comes so soft and so nicely, and you can see all the textures, and it is very nice. This is an experiment that we do with an overdenture in the dentures patients over 4 implants. We decided to go a little crazy and design lithium disilicate crowns, and we cemented over there. We did some pink, and take a look at the result. Very nice. And those are full mouth reconstruction, also full ceramic, 1 implant crown, and then you can play with the position and everything, and then have a very nice experience with dental photography. And also in the studio, that's an example of the studio that I showed before. Soft boxes, you can see the soft boxes in the eyes of the patient, and then the light comes very, very soft into the skin of the patient, and then you can see very nice all the color contrasts and textures. And then in that way, it makes you, I get to appreciate what we do. It makes more fun. I enjoy more what we do. So basically, what we are telling you guys is that, as Dr. Sandu said at the beginning, photography is a very powerful resource that we have in dentistry, and that we have to master. And then I have one last slide here. Remember, photography takes time. You have to learn the basics that I show you today, understand them, and practice, and then try to improve the settings and the light accessories that you have in your practice in order to get better pictures. Go out of the automatic mode. We don't want that. Take some time and play with the pillars of the photography: ISO, aperture, and shutter speed. And don't make the expensive mistake of just order the most expensive 6,000 camera and everything original, everything perfect, if you don't know the basic knowledge. And perhaps you may be smarter and invest in a regular camera, not the most expensive one, not the cheapest one, but then invest a little bit more in accessories to get a better lighting, better background. And then considering the post-processing. And then if you are going to do that, consider taking raw files. Raw files are basically heavier files. The quality is going to be better, and you can change that whether in your professional cameras or in the smartphones as well. And in that way, the file of every picture is going to be heavier, and you can then do more post-processing, whether in your app or in your computer. I hope that helps you a little bit, taking better pictures. Thank you for joining, guys, and I look forward to your questions and comments. Thank you.
Thank you, Manrique. That was a really informative lecture. I learned loads. It's interesting, my experience. I mean, I'm at work, and I have a D300. Bought this in 2008. And it's amazing. The memory card, look at this, 4 gigabytes, and I can still take a lot of photos on this. So I mean, it's moved on in leaps and bounds, photography, hasn't it? And this was not a full frame camera. And I bought a few years ago. I bought the D850, and it's full frame. And it's like you said, you know, your conclusion is this learning. And I have gone back to using my old camera because the lighting was different. I wasn't used to the colors, and I thought, you know what, I'll go back to my old camera, but I should spend more time to learn and practice it, really. So it's very informative. So what are your thoughts on ring flash? You know, when you're doing surgery, do you like using ring flash, or do you like using, you know?
Very good question. In surgery, in general, I like more the effect that you get when you don't have a direct light. When you have a ring flash, the advantage is that you get more light directly, you get a very nice picture, but the effect that you get with the twin flashes, that means when the light is coming from the side, it is nicer. It looks better, in my opinion. But regarding the lighting in surgery, ring flashes are very, very good. Right, so both of them are very good. And the other thing that we see is that when everything is sterile in surgery, if you have twin flashes, it takes more space. You come closer and then you touch everything that is sterile. So in surgery, it is a little bit more delicate. But if you manage to do that, there are a lot of colleagues taking surgery pictures with twin flashes and soft boxes, and the effects are amazing. They're very, very nice. But the ring flash is also a very, very good option. Yeah.
It's interesting you say that, because I've got a friend called Ricardo Kern. He's Brazilian, and I've been to his clinic, and he has soft boxes hanging off these gantries, and there's no ring flash. And you know, again, you know, dental photography has just gone in a different direction, and he's videoing, and the lighting is stunning, but you know, you have to have the setup for it, don't you? You know, it's
Exactly.
fascinating. Yeah.
Yes.
I mean, it's the same thing, isn't it? At Bern University, they have lots of, the setup is the same, isn't it? They have lots of gantries and lots of video because of Tony Schoolian and you know, Danny Boozer doing videos for the last 20, 30 years, haven't they, really? So it's, you're very lucky.
It is. The possibilities are amazing. Last year I was in congresses and they were doing live surgeries, and one surgeon was in Italy, the other one was in Hungary. It is amazing. All the with the digital technologies that we have right now, it is incredible, the possibilities that we have.
I mean, one thing that I find, you know, because you know, you can use a mobile phone to video some surgical procedures, you know, brief, showing a periosteal release or something like that. And what's really interesting is, you know, we all use, you know, LED lights now, don't we? And when you write a video, you get this sort of flickering. Do you know the reason for that, and how to, you know, manage that with a mobile phone?
What I have seen is just basically the experience with LED. They are very cheap. They're very easy to use and everything, but the quality is not very good and they're not very consistent. I am sure that this will change, and we will get better options. Probably there are already that I am not aware of, but so far with the best setting is with twin flashes, and with the smartphones, those auxiliary lightning or flashes that I show, those are the best ones. And I have seen images that are all very, very good, that if you see it in a presentation, you cannot tell was that with a smartphone or not. And that is why I think it's a very viable option. Yeah.
Yeah. And again, you know, you sort of touched on mirrorless cameras. And again, I'm meeting lots of very talented clinicians who are using these £7,000-8,000 Sony mirrorless cameras, and the images are stunning, aren't they? But they seem to. So I videoed a case, and the clinician, the guy was standing on the other side of the room, and yet when you get the video back, he's cropped in. It's still very, very clear. It's amazing.
Incredible.
How far moves. Yeah. So
they really did a very good improvement on that. And for me, the nicest thing is that they are lighter, right? They are lighter. The other one, professional with the macro lens, they were so heavy. And then you put twin flashes and the flash on top, just very heavy, right? And now they are very lighter. The micro lenses, they are also smaller, and you have a lot of electronic and the micro focus and everything. It is just really a crazy improvement. And the older ones, the mirror ones, they are not being fabricated anymore. I heard from some major. Incredible.
That's interesting. Yeah. So it means that we are moving in that direction. You know, maybe I might have to invest in one and learn and practice.
That's it.
Yeah.
With that, I would like to thank both of you for your time, your fantastic conversation. You know, I'm so glad that we invited Dr. Fonseca to give us this knowledge and, you know, show us that we can use dental photography for our advantage to make us more effective in every way. So, and also thank you very much, Dr. Patel, for your insightful questions and lovely conversation, and of course to all our audience who gave us a lot of support. I must say that Dr. Fonseca has written a blog on our Regeneration Academy, exactly talking the conclusion of this presentation, where he spoke about it, that there is a PDF to be downloaded, which will be included in that blog. And so you will get access to that. And thank you. With that, I would like to thank you very much to both of you and to our participants, and wish you a very good evening and maybe rest of the day whenever you are watching this webinar. So thank you very much again for your time.
Thank you for the invitation, and thank you everybody that joined. Thank you very much.
Bye-bye.
And we look forward to seeing our third webinar, which will be coming up in the near future with Alison
Raskin, Dr. Raskin, yes.
From the USA,
yes.
And she will be talking about her journey into implant dentistry from as an undergraduate to where she is now. So I think that'd be a fantastic webinar for everybody to find out how you can make it in the same way she has.
Absolutely fantastic. Thank you very much again, and wish you all the rest of the evening. Bye then.
Take care.
Thank you.
Bye-bye.
Bye-bye. Bye-bye.
Thanks, Manrique.